Guillain-Barré Syndrome, or GBS, is a rare disorder. It can be serious. This condition affects the peripheral nervous system, which is responsible for connecting the brain and spinal cord to the rest of the body. When someone has GBS, their immune system mistakenly attacks these peripheral nerves, leading to a range of symptoms that can vary in severity. GBS affects the nervous system. The peripheral nerves are crucial for transmitting signals that control both voluntary and involuntary actions. Our nervous system controls our movements. This includes everything from walking and running to more delicate tasks like typing on a keyboard or playing a musical instrument. It also controls our senses. The ability to touch, smell, hear, and see are all governed by the nervous system, making it essential for our interaction with the world around us. With GBS, the body's immune system attacks the nerves. This autoimmune response can cause inflammation and damage to the nerve fibers. This attack disrupts the signals between the brain and the body. When these signals are interrupted, it can lead to a variety of physical difficulties. GBS can lead to muscle weakness, tingling, and even paralysis. These symptoms often start in the legs and can spread to the upper body and arms. Imagine your nerves as electrical wires. These wires are responsible for carrying messages from your brain to your muscles and other parts of your body. These wires carry messages from your brain to your muscles. When everything is functioning correctly, these messages ensure smooth and coordinated movements. GBS is like someone damaging these wires. When the nerves are damaged, the messages can't travel properly. The messages don't get through properly. This can result in a range of symptoms, from mild weakness to severe paralysis. Your muscles can't move like they should. Everyday tasks can become challenging, and in severe cases it can affect breathing and heart rate. This condition is not contagious. You cannot catch GBS from another person. You can't catch it from someone else. It's important to understand that GBS is an autoimmune disorder, not an infectious disease. It's a rare autoimmune disorder. This means that the body's immune system, which normally protects against infections, mistakenly attacks its own tissues. This means your body mistakenly attacks itself. The exact cause of GBS is still unknown, but it often follows an infection or, in rare cases, surgery. It affects people of all ages. Children, adults, and the elderly can all develop GBS, but it's more common in adults and slightly more in men than women. Understanding GBS is crucial for early diagnosis and treatment, which can improve outcomes for those affected. The exact cause of GBS is still unknown. Despite extensive research, scientists have yet to pinpoint the precise mechanism that triggers this condition. However, it often occurs after a bacterial or viral infection. These infections can range from common colds and flu to more severe bacterial infections. Think of it like a case of mistaken identity. The immune system, which is designed to protect us, mistakenly targets our own body. The immune system, which normally protects us from germs, gets confused. Instead of attacking harmful invaders, it turns against the body's own nerves. It starts attacking the protective covering of the nerves called myelin. This myelin sheath is crucial for the proper functioning of the nervous system. This attack on the myelin disrupts nerve signals. When the myelin is damaged, the nerves can't transmit signals effectively. Imagine a water hose with holes in it. Just as water leaks out of the hose, nerve signals leak out and fail to reach their destination. The water, like the nerve signals, leaks out and doesn't reach the end. This disruption in signal transmission leads to the symptoms of GBS. This disruption causes the symptoms of GBS. These symptoms can include muscle weakness, tingling sensations, and even paralysis in severe cases. The severity of these symptoms can vary greatly from person to person. Some may experience mild weakness while others may face significant mobility challenges. The immune system's attack is usually triggered by something. Identifying this trigger can be crucial for understanding and managing the condition. This trigger could be a recent infection. In many cases, patients report having had an infection shortly before the onset of GBS symptoms. Common infections linked to GBS include Campylobacter jejuni, a bacteria found in undercooked poultry, and the flu virus. These infections can set off the immune response that leads to GBS. Sometimes even surgery or vaccination can be a trigger. While these cases are rare, they highlight the complexity of the immune system's response. The symptoms of GBS usually appear gradually. They often start with tingling and weakness in the feet and legs. This tingling can feel like pins and needles. The weakness can make it difficult to walk or climb stairs. As the condition progresses, the weakness can spread to the arms and upper body. Some people experience difficulty with everyday tasks like buttoning a shirt or brushing their teeth. In severe cases, the muscles involved in breathing and swallowing can be affected. Other symptoms may include numbness, loss of coordination, pain or aching muscles, abnormal heart rate, and fluctuations in blood pressure. If you experience any of these symptoms, especially sudden weakness or tingling, it's crucial to seek immediate medical attention. Early diagnosis and treatment are essential for improving outcomes in GBS. While the exact cause of GBS remains a medical mystery, researchers have identified several potential triggers. These triggers are thought to set off the immune system's abnormal response. Infections. The most common trigger for GBS is an infection. These infections can be bacterial or viral. Some of the culprits include Campylobacter jejuni, cytomegalovirus, Epstein-Barr virus, and Zika virus. Surgery. In rare cases, surgery can trigger GBS. It's believed that the stress of surgery may confuse the immune system, leading it to attack the nerves. Vaccination. While extremely rare, there have been isolated cases of GBS following vaccination. However, the benefits of vaccination far outweigh the risks. Other triggers. Some other potential triggers are under investigation. These include certain medications, exposure to toxins, and autoimmune diseases. Section 5. Diagnosis, the path to understanding GBS. Diagnosing GBS can be challenging. It requires a thorough understanding of the patient's medical history and a keen eye for detail. It often involves a combination of medical history review, physical examination, and specific tests. Each step is crucial in piecing together the puzzle that is GBS. Medical history. Your doctor will ask about your symptoms, their onset, and any recent illnesses or vaccinations. This helps in identifying potential triggers or underlying causes. Physical exam. The doctor will check your reflexes, muscle strength, and sensory function. These physical signs can provide important clues about the extent and nature of nerve involvement. They might look for specific signs like absent reflexes or difficulty walking. These observations can be critical in differentiating GBS from other neurological conditions. Tests. Several tests can help confirm the diagnosis of GBS. These tests are designed to provide a clearer picture of the nerve damage and its impact on the body. Lumbar puncture, also known as spinal tap. This test analyzes the cerebrospinal fluid for signs of inflammation. Elevated protein levels in the fluid can be a key indicator of GBS. Electromyography and nerve conduction studies. These tests measure the electrical activity of your muscles and nerves to assess nerve damage. They help in understanding the severity and progression of the condition. These tests help rule out other conditions with similar symptoms. Accurate diagnosis is essential for effective treatment planning. Early diagnosis is crucial for starting treatment promptly and improving outcomes. The sooner GBS is identified, the better the chances of managing the symptoms and aiding recovery. Section 6. Treatment options. Restoring strength and function. While there is no cure for Guillain-Barré Syndrome, treatments can help manage the symptoms, reduce the severity of the attack, and speed up recovery. The goal is to support the body's natural healing process. Intravenous immunoglobulin, or IVG, delivers healthy antibodies from donated blood through a vein. These antibodies help calm down the immune system's attack on the nerves. Plasma exchange, also known as plasmapheresis, involves removing a portion of the blood plasma, which contains the harmful antibodies, and replacing it with healthy plasma or a substitute. Other therapies may include pain relievers, medications to prevent blood clots, and physical therapy to improve muscle strength and coordination. The choice of treatment depends on the severity of the condition and individual patient factors. Early intervention is key to maximizing recovery. Section 7. The road to recovery, prognosis, and long-term effects. The recovery process for Guillain-Barré Syndrome can be long and challenging, often taking months or even years. Most people with GBS eventually recover, but the extent of recovery varies. Several factors can influence the recovery process. Younger individuals tend to recover faster. Those with milder cases generally have a better prognosis. Early diagnosis and treatment are associated with better outcomes. Some individuals may experience long-term effects, such as residual weakness, fatigue, and lingering nerve pain. With proper rehabilitation and support, most individuals can regain a good level of function and independence. Section 8. Reducing the risk prevention strategies for Guillain-Barré Syndrome. While there's no guaranteed way to prevent GBS, certain measures can help reduce the risk of developing this condition. Staying up to date on vaccinations, especially against influenza and Campylobacter jejuni, can lower the risk. Practicing good hygiene, such as frequent hand washing and safe food handling, can prevent infections that may trigger GBS. Seeking prompt medical attention for any infection can help prevent complications, including GBS. While these measures can reduce the risk, it's important to remember that GBS is a rare disorder, and most people exposed to these triggers will not develop the condition. Section 9. Seeking help, the importance of early intervention. Guillain-Barré Syndrome is a serious condition, but early diagnosis and treatment significantly improve the chances of a good recovery. If you or someone you know experiences sudden weakness, tingling, or other symptoms of GBS, don't delay seeking medical attention. Timely intervention is crucial for managing the condition and preventing complications. Remember, GBS is treatable, and with appropriate care and support, most people can make a significant recovery. Early action is the key to a brighter outlook.